So one of the main risk factors for developing ulcers in our stomach is a bacteria called Helicobacter pylori or H. pylori.
Can stomach ulcer convert into the cancer cell?
Stomach pain is one of the common symptoms. When we say stomach pain, the pain is mostly in the upper part of the abdomen. So it is above the navel in the center. The pain can be dull discomfort and it can be burning type of pain. Some people the pain gets relieved by eating food. In some people the pain gets worse by eating food depending on where the ulcer is.
Hi, hello, namaste viewers. Welcome back to our YouTube channel. I am Shweta from Bangalore Gastro Center. Stomach ulcer is something we all get worried about, especially when we experience the stomach pain very frequently. In today's session, we all learn about this stomach ulcer. To give more information about this stomach ulcer, we have Dr. Yoganand Reddy, gastroenterologist, with us today. Namaste, sir.
Namaste.
So nowadays, we can hear about more patients diagnosed with stomach ulcers. So first of all, what do you mean by stomach ulcer and how do they develop, sir?
So stomach ulcers are essentially, imagine when you have a fall and there is damage to the skin. So there is abrasion and then you develop a wound. So just like that, there is wound in the stomach. So there is damage to the lining of the stomach or the coating of the stomach lining. So this is what we call as ulcer. And these ulcers can be in the food pipe, in the stomach, and in the first part of the small intestine, what we call as a duodenum. So these are broadly we categorize as peptic ulcers. So these ulcers are extremely common. They are throughout the world, not just in India. And we see in our medical gastroenterology practice pretty much daily. So why do they develop? Obviously, not everybody has stomach ulcers. So there are some people who have certain risk factors. So one of the main risk factors for developing ulcers in our stomach is a bacteria called Helicobacter pylori or H. pylori. So this is extremely common in Southeast Asia. So in India, for example, if I randomly get hold of 10 people on the road and if I have to check, 4 of them will probably turn positive for this bacteria if we test. But not everybody has symptoms or problem from this bacteria. In a lot of people, this bacteria is silent, sitting in the lining of the stomach without causing any problem at all. In some people, it is causing a lot of irritation to the stomach lining. It is causing changes to the stomach lining, and then eventually it starts to form into an ulcer. And these ulcers can be sometimes one, sometimes multiple. So this is one of the common causes of ulcer throughout the world. And there might be medicines which patients might be taking nowadays. For example, a lot of people have heart problems. They might be taking medicine called aspirin, which can also disturb the or damage the lining of the stomach, and that can also cause ulcer. There might be certain strong painkillers people will be taking for example, migraine headaches or back pain or knee pain. So these anti-inflammatory drugs, painkillers can also cause damage to the stomach lining and they also can cause ulcers. And people who are indulging in alcohol excessively and also who smoke regularly, they also have increased risk of these gastric issues, including ulcers. And commonly we have all heard of this hurry, worry and curry. So hurry is people who are not eating food on time. They are just they have a very hectic lifestyle. They don't get proper sleep. They are eating at odd times and missing out on food. And so that's hurry. And worry is people who are constantly stressed, so anxious, chronic stress, and that can also stimulate more acid production in the stomach that can cause damage to the lining of the stomach, leading to an ulcer. And curry is essentially masala rich foods or foods that have got a lot of spices, chilies, for example, a lot of outside foods including biryanis which have got a high amount of masala. So this can also cause irritation to the lining of the stomach. So these are the common reasons for people example, developing ulcers.
Okay, sir. For example, if at all I have stomach ulcer, how do I come to know that I have stomach ulcer? What are the symptoms there?
So, not everybody with a stomach ulcer will have the same symptom, and of course, we all associate stomach pain with an ulcer. So, stomach pain is one of the common symptoms. When we say stomach pain, the pain is mostly in the upper part of the abdomen, so it is above the navel in the center. The pain can be dull discomfort, and it can be burning type of pain, and in some people the pain gets relieved by eating food. In some people the pain gets worse by eating food, depending on where the ulcer is. So pain is one of the common symptoms, but there are other symptoms without pain. For example, they might start to feel nausea, so like a vomiting sensation all the time, or they might actually puke or vomit every so often. They will start sometimes feeling very full, so eating small portion of food they feel very full and feel very heavy, so they will start cutting down on the amount of food what they take. So by reducing the amount of food what they take, they start to lose gradually weight and might start to feel a bit weaker. In some people, the stomach ulcers are causing small amount of internal bleeding, because it's only small amount of blood loss. We don't see the blood coming out in the form of black motion or any frank blood. So when they have a blood test, they might notice their iron levels and the blood count has gone very low. So they might be looking pale and feeling extremely tired. And so this can also be one of the symptoms. And of course, they start losing weight. This is again one of the symptoms we associate. So there are variety of symptoms, and different people present with different symptoms, and some people have everything.
Okay, sir. So nowadays, people are very scared about this stomach ulcer. Why? Because can stomach ulcer convert into the cancer, sir?
So this is of course one of the very important questions, and people, whenever they come to know that they have an ulcer in the stomach, they or their relatives start to get worried that, oh, what if this is cancer? So it is a natural thing to get worried, but one thing to be reassured is that 99% of these ulcers are not cancerous, so they do not turn into cancer. So when we, for example, do check and find out by endoscopy that there is a stomach ulcer, we can usually tell by looking at it whether it is a simple ulcer or whether it looks something different. So in a vast majority of people, the ulcers do not turn into cancer, but the risk of cancer is of course there in a very small percentage of people. But that cancer risk can also be with other risk factors. For example, if the person is a smoker, because smoking is an independent risk factors for various cancer, including stomach cancer. And if they are indulging in alcohol regularly, or they have other lifestyle issues, that can also be a risk factor for cancer. So stomach ulcer itself doesn't mean cancer, and as I said, 99% of these are benign, and there is not a lot we need to get too worried about.
Sir, can we find out the stomach ulcer through some tests? Is it possible?
Correct. So we can't just diagnose somebody as stomach ulcer just by feeling their abdomen and say you have an ulcer. There are tests to confirm that they have an ulcer or not. So normally when we see in our medical gastroenterology practice, we of course go through the patient's history to see how long they have had symptoms, what medicines they might be taking, because of it is important to ensure that that medicines may have to be stopped, or at least temporarily, and also see what is, if there is any lifestyle factors that might be contributing. And when we examine the patient, we can sometimes feel that they are a bit sore and tender in the abdomen. They might be looking pale because their blood count is low. So there might be a need to do some simple blood tests to find out what is their blood count, hemoglobin. And the only confirmatory test to actually see if they have an ulcer or not is something called endoscopy. which is a very simple procedure. So we use a very flexible tube which is the size of a pencil that has got a high definition camera and a light, which we spray the back of the throat with an anesthetic spray to numb the throat. And it's a very safe procedure because we do in small children as young as 2-3 year olds. So by looking down the food pipe, the stomach and the first part of small intestine with the endoscopy, we can see the ulcer and also test for this H. pylori stomach bacteria at the same time and confirm. And if the ulcer looks anything slightly different, as I mentioned previously, if we have any suspicion that this ulcer doesn't look quite right, we do not like to take chances. So those kind of ulcers, we take small samples to exclude any possibility of cancer or anything that doesn't look normal. So the gold standard for confirming the ulcer will be endoscopy, because this is not something you can detect by doing an ultrasound, CT or an MRI scan.
Okay, sir. Sir, can ulcers be cured completely?
So this is a good question, because this is what usually people get worried, that once I have an ulcer, will I have to live with this for the rest of my life? Ulcers can be cured completely, and because we have to eliminate the risk factors. So one of the risk factors which I mentioned is the common one, is the bacteria, the stomach bacteria called H. pylori. So there is some specific treatment which includes a combination of antibiotics and ulcer healing medicine we give for a set period of time, and taking that medicine that should get rid of the bacteria from the stomach lining and also allow the ulcer to heal completely. Of course, if they are taking certain medicines which might be contributing, we have to sometimes discuss with their doctors to see if it is safe to stop at least temporarily to allow the ulcer to heal. If they have got some lifestyle issues, for example, smoking and alcohol regularly, which might be interfering with the ulcer healing, those things we need to address, and also their food habits, those need to address. So if we can rectify all these and remove the risk factors, these ulcers can be completely cured.
Okay, sir. What are the food we have to avoid to prevent that?
So the foods that one should avoid if they have ulcers, or foods that they need to try and cut down in terms of not getting these ulcers, or mainly spicy kind of foods. So foods that have got a lot of masala, chilies, because if you already have an ulcer in the stomach lining where it's sore, by taking spicy food, that irritates the stomach lining more. And those people who already have a lot of burning sensation because of the ulcer, if you are taking a lot of citric foods, for example lemon, too much of tamarind based foods, orange, musambi, these kind of citric foods can also worsen the gastric symptoms, so better to cut down. And foods that have got a lot of fat, so greasy fried foods that can sit in the stomach can for a longer period of time, which can be heavy on the stomach to digest, these foods should be avoided. And processed foods, all these packaged foods that have got various kind of preservatives, coloring agents, additives, they can also be causing sometimes problems to the healing of the ulcer. And as I mentioned, if there are on some medicines, that something that we need to take care of to ensure that the medicines is not interfering with the healing. Some people consume a lot of coffee and tea, so we have to address that issue by restricting their intake of coffee and tea to 1 or 2 small cups in the day, and trying to encourage them to eat more of smaller portions of food more frequently, mild food, and food that is mostly of vegetarian, and cut down on the non-vegetarian because it will be heavy to digest. So these are the certain tips in terms of the foods to allow the ulcers to heal and also minimize these gastric symptoms.
Okay, sir. Sir, thank you so much for giving lots of information about this stomach ulcer. Not only information, you also gave some tips for the viewers to prevent that stomach ulcer. Thank you so much, sir.
Thank you.
So, viewers, today we learned a lot about the stomach ulcer. For more informative videos, please subscribe our channel and share to your friends as much as possible. Thank you.